So I'm here with Dr. Bob Bransfield. He's been an active board member for years and very involved with ILADS, also in the psychiatric community. We share patients at times, and so I wanted to ask Bob where he's at on a couple topics. So Bob, and in this day and age, you must see a fair amount of psychiatric issues that pop up that end up being related to a tick-borne illness.
That's correct. I've been working a lot with these patients over the past 20 years, and often I pick up a case when I wasn't looking for it, and when you have that awareness of the pattern to look for, then that opens a door to other treatment options, and you can help people, whereas previously they might have been labeled as chronically ill and not able to recover to the degree that they could when you address all the issues that are part of their illness. One
of the things that happened when I was a young doctor, which was a while ago, 1990, there was an article with Dr. Steer as one of the authors where he described irritability, anger out of proportion to anything they've seen before, and I found that for that to be one of the top symptoms in Lyme disease, and this was a chronic Lyme disease series, is you must see a fair amount of irritability in your practice.
One way to think of it is when you acquire Lyme disease, it can affect the brain, and there's 3 different major ways that can occur, but it doesn't do anything good to the brain or to the body. And a certain percent, and I've asked that question to thousands of people, and a certain percent have irritability, anger, decreased impulse control. Of course, there's many that don't, and it's puzzling what makes that percent have this symptom, whereas other people don't, but nevertheless we see it. It may be related to co-infections such as Babesia, Bartonella, and the irritability is there, short-tempered, short-fused. A lot of times when you see the anger, it can be bizarre and senseless, without logic, sometimes very reactive, can be very intense, and contrary to the person's usual personality before they became ill.
I think it's pretty easy often for the doctor to see one emotion. You know, it doesn't have to be irritability. Sometimes it's anxiety, sometimes depression, sometimes an OCD type pattern. And in all of those patterns, it's very easy to jump to a psychiatric diagnosis without asking any of the underlying questions to realize when there's a bacteria or a parasite. So you must dig in a little deeper than just the psychiatric observation.
When we make a diagnosis, we make it according to symptoms. We don't make it according to cause of those symptoms. So depression, anxiety, any of those things you can categorize as a symptom or a syndrome, but it may have different etiologies in different people. If you know the etiology, the cause, then you can treat the etiology, not just the symptom. And if you think what mental illness is or psychiatric symptoms, basically in a state of health, your mental functioning helps you adapt. So mood changes, cognitive abilities help you to adapt to the current situation in life. And you should be afraid in threatening situations and be daring when you can be, and it should match what's going on. But in a state of illness, there's impairment, so there's maladaptation. So a person would feel the wrong emotion, the wrong reactive response, the wrong degree of stress reactivity for the situation at hand. And that's what illness is, and it appears that there's ways that these infections can affect our mental functioning that's destructive and cause maladaptive reactions.
I know you've been a strong advocate of microbes, that even if there's a psychiatric sort of look, that you've always been pushing for. Where's the cause? Is it a microbe? And I imagine that that's still a strong interest of yours.
Right, it goes with the NIH Human Microbiome Project, that the cause of many illnesses that were previously unknown can have a biological cause with infections. Now, if you look at most diseases are developmental disorders, where there's developmental impairment, or degenerative disorders in late life. But mental illness is rather different. It affects people in early and midlife, so it seems like it follows some other pattern of cause or etiology than most illnesses. And because it affects young people, midlife people, to that degree, then infections and the immune reaction to these infections is a high likelihood. Now, it may not just be tick-borne, it may not just be Lyme disease, but many, many different infections, and there's hundreds of articles supporting, thousands actually, supporting different infectious etiologies to mental symptoms.
So if you look at PANDAS, which is this pediatric neuropsych issues related to strep, and you look at autism, you must find at different times that if you look a little deeper, sometimes there's a bacteria in the background that, well, PANDA would be strep, but you must be always looking a little further at what the cause of these illnesses are.
Well, correct. When you see like PANDAS, and then the concept is expanded to PANS, when you have an infection, the early response is inflammation. And in a healthy state, you have early infection, then you have adaptive immunity, you recover and you do fine. But in these cases, something else happens. Instead, you're almost stuck in a gear shift, where instead of shifting from your early immune response of inflammation to adaptive immunity, it's stuck in the middle. So you can see persistence of inflammation and inflammatory type mental symptoms are of a different type, or autoimmune type symptoms, which is what you see with PANDAS or PANS. And that was originally described in the early 90s by Dr. Sweeto with strep, but it actually has been described before, and it's been called other things throughout history. But we see those autoimmune reactions with many other infections besides strep, including some with tick-borne diseases.
There's a couple questions that are coming off the live stream. So one is, do you treat irritability? This one says morning irritability, but I imagine irritability can be any time. Well,
I treat irritability. Think of what irritability is, an outward manifestation, and often it's a consequence of frustration. And a person's frustrated when they're not achieving the goal they're trying to achieve. So it's sort of a chain of setting a goal, having an expectation, being frustrated, and having low frustration tolerance. Some people that have high frustration tolerance would not have irritability, but you see reduced frustration tolerance a lot of times with these tick-borne conditions. And then the irritability is the outward effect of that.
Yeah, I always find that people who've been sick for a while with Lyme is that there is a certain level of, they've been used to it for so long, and you need a little counseling or a little support, because as I treat with an antibiotic, they need that to acknowledge and work with them to get out of that pattern.
Well, the antibiotics help. There are certain psych meds that help reduce the frustration tolerance. That helps. Insight, awareness of how all these things fit together. One thing you often see is that your average person that gets Lyme disease is an outdoors, active mover and shaker, lover of life type of person. And that's why they got the disease. Now they have a disease that makes them have multiple symptoms and fatigued, impaired, and functioning at a much lower level, and that causes a great amount of frustration because it's so contrary to their pre-existing personality. And that's partially a source of some of the frustration and irritability.
Now, do you see a role for IVIG at times?
It does seem that the impairment that we see is mediated by the immune system. So even though there's an infection, it's more the body's reaction to the infection through the immune system that's responsible for causing the symptoms. And PANDAS is a good example, where you see a certain cluster like the tics, OCD, the bladder problems, the anger, and those in that cluster, making the immune system react in a healthier way is a valid treatment. Okay. And that's one treatment that's been used, and I've seen some cases that have had dramatic improvement as a result of IVIG.
Well, the next segment I'm going to have is going to be talking to a brief soundbite on disability. Mm-hmm. So I assume that despite all that you do, that there are some kids who can't go to school, mm-hmm. and there's some disability out there with this type of illness.
Yeah, there's quite a bit of disability. When you look at it, it's very tragic, because your average disability case is someone who maybe has a heart, lung condition in the tail end of their life. So they lose a couple years of productive employment in their, let's say in their 60s. That's the average case. But instead, when we're dealing with these tick-borne diseases, it can affect someone in childhood, young adult, so you can look at decades of disability. And it's far more burdensome to the family, to overall costs, caretaker burden, but it's also more costly to insurance companies, because they know they have a much more serious, longer period of disability that they would be financially responsible for. So you can see highly creative, evasive tactics on the part of insurance companies to not be responsible for these claims. And they can be the very insurance companies that would negate, when they negate the significance, but they would also deny someone getting a policy. So it depends on which side of it you're looking at it from. But it seems they recognize the seriousness and don't take the responsibility that they should.
Okay, Bob, thanks. I think just to remind those who are coming in later on the live stream, is that we're here to capture a slice of the International Lyme and Associated Diseases Society meeting in San Diego, and is to capture where we are with Lyme disease, co-infections, and all the range of speakers that are here. We're taking a 3-hour soundbite to explore these topics. We're particularly promoting the physician training program, so no matter where you are in life, if you know a doctor, if you are friends with a doctor, it's nice to encourage them to take a week out to come and train with one of the physicians that's been working with Lyme disease. Also, that all these things cost money, the production costs money, everything costs money, so if we still are encouraging people to sign on to ILADS, sign on to the Power of Us, and make some contribution so that this type of programming can continue and grow. So before we roll the tape, Bob, thank you very much for joining us.
Thank you, Dan.
Dr. Bransfield,
Okay.
pleasure.
Yeah. Same.